Hi, I'm Amy, the pharmacist. So I understand you have some questions?
Hi, I'm Mario, and my doctor suggested I talk to a pharmacist about quitting smoking. Do you have the time for this?
Sure. Why don't you tell me a little bit about what you're thinking? How soon you'd like to quit and why you want to quit?
My cholesterol and my blood pressure are high. My father and my uncle both had heart attacks when they were pretty young. So my doctor's been telling me that if I quit, I'll cut down on my chances of having a heart attack.
That's correct. Quitting would be important for you, and it will reduce your chances of having heart problems.
So that's the situation. Now, I've tried to quit a couple of times before, but it didn't work. So what I was hoping is that you could go over the different options and help me pick the best one.
I'd be happy to do that. First, tell me exactly which products you used, and more importantly, how you used them.
Well, first, I tried the gum. Now, I like to chew gum, so I thought this would be good. So I chewed about 3 to 4 pieces of gum a day. But I was miserable and I started smoking after 4 days. Then I tried the patch a couple of months later. I felt pretty good for about a week, so I quit using it. Didn't think I needed it anymore. I started smoking 2 days later.
Well, based on what you've told me, it sounds like you didn't get the full benefit of the product. A few pieces of gum won't get enough nicotine into your body to make you comfortable. You need at least 9 pieces a day for it to be effective. And it has to be used in a very specific way, not chewed like regular chewing gum.
I admit I didn't read the directions last time.
As for the patch, it sounds like it worked for you. You just didn't stay on it long enough. We recommend 10 to 12 weeks. This gets enough nicotine into your body to help reduce most of the withdrawal symptoms while you work on learning to live your life without cigarettes. You were able to quit for a week with it, so it seems like it might be a good choice now, but there are others as well.
Yeah, my doctor said something about a pill. I didn't like the taste of the gum much.
Well, that's understandable. But you should know there are new flavors that my patients say taste better. To be honest, all the medications are effective. It's just a matter of which you prefer. You've already tried the patch. There's also a nicotine lozenge, a nasal spray, an oral inhaler. In tablet form, we have bupropion, which you've probably heard called Zyban. And there's a newer medication, varenicline or Chantix.
Yeah, I heard of those. But I think I'd rather stick with the patch. And this time I'm going to make sure I keep it on long enough.
Sounds like a good choice for you, and given that you have some experience with it and you know that it works for you. How many cigarettes do you smoke a day?
About a pack a day.
Okay, so you'll want to start with the 21 milligram patch for 6 weeks, and then the 14 milligram patch for 2 weeks, and then the 7 milligram patch for the last 2 weeks. It's pretty easy to use. On the morning of your quit day, I want you to put one patch on a hairless part of your upper body. You leave it on for 24 hours. And the next morning, you take that off. You put another patch on in a different location. You want to switch sites so you don't get any skin irritation. If you have trouble sleeping, you can take it off before you go to bed. Just read the directions on the box, and if you have any questions, let me know.
Okay. I'm going to try it again and read the directions and stick with it this time.
One more thing. There are 2 parts to smoking, so there are 2 parts to quitting. It's an addiction to nicotine and a habit. The patch will take care of the physical addiction and help with the withdrawal symptoms. But you'll have to make changes in your behavior if you want to stay quit for good.
Yeah, Dr. Ward mentioned that to me, and he gave me the card for this quit line.
That's perfect. Our state quit line is excellent and convenient. So, let's talk about picking a quit date, and we'll get you set up with a box of patches.